Earlier this week, the Biden administration finalized the first ever minimum staffing rule at nursing homes. The mandate requires that all nursing homes that receive Medicare and Medicaid provide a total of 3.5 hours of nursing care per resident per day. Vice President Harris also acknowledges that the new rules will help staff who are dealing with harassment and burnout. Tonight, we're taking a look at the impacts this mandate could have right here in Iowa. Local 5's Megan McPherson joins us now with more on this. And Megan, you're hearing mixed reactions really from nursing home advocates about these new rules.
Yeah, that's exactly right, Stephanie. Nursing home industry leaders and many Republicans have objected to the new staffing rule, saying this requirement could force some facilities to shut down. But for others who may have loved ones in nursing homes, they hope this change could lead to better care.
For residents, this will mean more staff, which means fewer ER visits.
After months of debate, the Biden administration has now finalized plans for a new set of regulations in nursing homes, aimed at improving staffing levels so that patients receive better care. The topic hits home right here in Iowa for Diane Hathaway and Julie Ryan, both women losing their mothers who lived in Iowa nursing homes after expressing concern over their treatment.
The month before my mother passed, she was hospitalized twice for the same issues.
Hathaway says her mother, Evelyn, was severely dehydrated and malnourished, but those health issues were never properly communicated.
Because I was not getting full transparency from their nursing home.
After Evelyn died in January of 2021, the home she was living in received 5 federal regulatory violations. For years, the two women have been advocating for legislation that would allow nursing home residents to install cameras in their rooms, a way for families to monitor their loved ones if staffing issues prevail. That legislation has never advanced, but Hathaway and Ryan are encouraged by the new staffing rule. Lobbyists for the nursing home industry in Iowa, on the other hand, are not. The Iowa Healthcare Association telling Local 5 that the mandate will, quote, put more than 2,300 current Iowa nursing home residents at risk of losing their care due to providers' inability to meet the mandate.
And the mandate will be phased out over the next 3 years, but rural Iowa communities will have up to 5 years, given that it may be harder to meet the staffing requirements in those areas.